Egg donation is an assisted reproductive technique carried out with the eggs of a donor. This technique is offered to patients in whom it is very difficult to achieve pregnancy with their own eggs due to a reduced ovarian reserve. The donor is anonymous, young, in good health and screened for common infectious and genetic diseases. She is chosen according to the physical characteristics of the couple. The donor's eggs are then fertilized with the sperm of the patient's partner or with sperm coming from a donor when there is male infertility as well. Once the embryos have been obtained, the patient begins hormonal treatment so that the endometrium reaches sufficient thickness before carrying out the embryo transfer, which is a procedure that does not require anesthesia. The hormonal preparation of the endometrium mainly consists of taking estrogens orally or transdermally, and subsequently vaginal and subcutaneous progesterone treatment will also be necessary. For patients with spontaneous regular cycles, it is also possible to carry out the embryo transfer on a natural cycle. In this situation, ultrasound monitoring is performed to know the moment of ovulation, which we then trigger, and the embryo transfer is performed approximately 5 days later. It is important to mention that although it is the genetic heritage of the donor that is transmitted to the child, we know today that the behavior and environment of the mother throughout the pregnancy and after birth influence the development of the child, influence the activation or not of certain of the child's genes, and therefore it does not mean that the child will not resemble to the mother. And this phenomenon is what we call epigenetics. It is a very important concept in the process of acceptance before undertaking this medical approach.